Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of September 20th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Alameda County now has 113,392 cases. That is up about 1,100 cases from last week, so certainly slowing down from the weeks before. And 1,329 individuals in the county have lost their lives to COVID-19, and this is an increase from 6 last week. In terms of vaccination, we continue marching ahead, and 90% of those 12 and up have at least one dose, and 77% of those 12 and up are fully vaccinated. Oakland is trailing just a little behind at 88% and 74% respectively. In terms of daily case rates and hospitalizations, both are thankfully trending down, and we certainly hope that this is a trend that will continue. And while we are certainly grateful that this is the case, we would be remiss to not be preparing for future waves, perhaps in the fall and the winter. Those things remain to be seen. But given what we know about what is going on in different parts of the country, in different parts of the world, and also the nature of this pandemic up until now, we certainly will anticipate waves in the future. And in terms of vaccination, while we are certainly pleased that the overall vaccination rates are looking high, we do know that there is variability across the county, with some of our zip codes continuing to be less vaccinated than others. And as you can see here, we still have 3 zip codes that are under 70% vaccination rate, and those are 94605 in East Oakland, 94578 in the Hayward and Ashland area, and 94607 in West Oakland. The good news is that all of the zip codes continue increasing, some faster than others, but again, we will be looking to ensure that across the county we have even vaccine coverage. Now, by way of a booster update, again, which unfortunately I've been having to do for a few weeks now, and I may need to continue to do so for a few more weeks until this whole matter settles down. But what has recently happened on September 17th, the Vaccines and Related Biological Products Advisory Committee, or VRBPAC, had a more than 8-hour meeting reviewing data on boosters. And the question before them was whether to approve boosters for the general population, and they voted 16-2 against recommending booster doses of the Pfizer vaccine specifically for the general population. So they then put forward another motion for approving the booster dose emergency use authorization for Pfizer for individuals 65 and up, as well as those 16 and up at high risk of severe COVID-19. And the committee recommended that the additional dose be administered at least 6 months after the 2-dose series was completed. And they also seem to be in agreement that those with high risk for occupational exposure, like healthcare workers, should also be included in the emergency use authorization. So the VRBPAC makes the recommendation for the FDA to consider and then act upon. And until now, they've not yet acted upon it, but we expect that to be happening any moment. Once they do, that is what provides the regulatory allowance to then proceed with recommendations. So this is not at all a final recommendation. We are just working through the steps. And so the next step is that the Advisory Committee for Immunizations Practices, or ACIP, will meet. They actually have a 2-day meeting scheduled this week, September 22nd and 23rd, where they will take this issue up, and hopefully, presumably, the FDA will say something before then. Once the ACIP deliberates, they make their recommendations to the CDC, and then the CDC who puts out that immunization schedule. So that is where we will see the actual recommended schedule coming out once that happens. So we will be keeping an eye on that and reporting on that, I'm sure, again next week. So today we are going to be talking about overweight and obesity as it relates to COVID-19. And I know that this might not be the most welcome conversation, and that would not be unlike many conversations that unfortunately we have to be having through this pandemic and really in healthcare in general. But it's a obligation of the medical community and the scientific community, and especially of physicians and medical providers, to let patients and individuals know when they are at risk. And it is an obligation I take very seriously. And just like I would tell a patient, I would rather give it to you straight now, because the one thing I would never ever want to hear is, "Doc, why didn't you tell me this could happen?" Or "Why didn't you tell me that I was at risk?" So that is the conversation that we're having today. So overweight and obesity are considered a weight that is higher than what would be considered healthy for a given height. And we would describe that as overweight and obesity. And I'm going to get into some of the details and some of the limitations around how we're able to discern this. But the tool that we use is called the Body Mass Index, or BMI, and it's a screening tool for overweight and obesity. And BMI is not a direct measurement. It's really a proxy measurement of body fat, because it's only measuring excess weight rather than excess fat. But given this limitation, despite this limitation, studies have shown that the BMI is correlated to excess fat. So there are all kinds of more sophisticated ways to measure body fat, like underwater weighing and some dual energy X-ray techniques. And there have been studies that show that the BMI correlates well to those other more direct measures. And perhaps more importantly, there's also been studies that have shown that the BMI level correlates with future health risk. So a higher BMI predicts future morbidity and mortality, or sickness and death. So COVID or not, BMI is an important measure. The limitations of the BMI: it doesn't, again, measure the body fat directly. It does not take into account many factors like age, gender, ethnicity, muscle mass. Those are all things that can influence the relationship between the BMI and the actual body fat. It's also unable to distinguish between excess fat, muscle, bone mass, and it also doesn't give us any indication of the distribution of body fat, which is an important indicator for future morbidity and mortality. But given all of this, or despite all of this, BMI is still a reasonable indicator of body fat for both adults and children. And one thing to note, it should not be used really to necessarily diagnose, but really more so to screen, and also as something to measure, to track your status of your BMI going up or down. And I will tell you that your physician is most likely calculating your BMI every time you go to a doctor's appointment. They may or may not be discussing it with you, and I would urge you to have that conversation with your physician to see about your BMI and to discuss some of the particulars that I mentioned, because they will be able to let you know what some of maybe the factors are for you specifically, and if something needs to be done, what that might be, and may even want to prescribe for you a nutritional plan, an exercise plan. I call that a prescription. I know that it's more of a behavioral prescription, an outdoor prescription, get outside. Those are all things that a physician should be able to speak with you about. Now, you can also check your BMI on your own. So if you just do a basic search online, you can put BMI Calculator. Make sure that if you are looking for an adult, that you put adult, And if not, if you're looking for a child, that you get the one for pediatrics. But the body mass index can be calculated on some of these simple calculators. This one here is taken from the NIH website. And really all you do is you put in your weight and your height, and then you compute your BMI, and it gives you a result. And as you can see here, I put in 5'9" and 199 pounds, and you can see that the BMI calculated is 29.4. So you look over at the categories to the right, and you see that that's really up on the upper end of overweight and almost in the obesity category. The reason why I selected this height and weight is because this is actually the average height and weight of an adult male in the United States, and that was for the time period up to from 2015 to 2018. And so this was the average size of an adult male, and presumably this may have gone up. There was a recent report in the American Psychological Association that 42% of adults reported undesired weight gain during the time of COVID. So we know that with sheltering in place and many people having decreased activity, not able to go to the gym, maybe closer proximity to the refrigerator, we know that there was undesired weight gain, not to mention all of the stress, depression, and other things that have come along with shelter in place. And so we know that there have been increases in weight during that time, and we've seen that as well with our pediatric population who were, of course, sheltering in place as well and may not have had as much physical activity. And so again, this is something that is important just for you to be able to know, and ultimately something that you'll want to speak with your physician about to see if there are any individualized interventions that might be recommended. Now, as it relates specifically to COVID, because that is really what we are wanting to address today, there was a recent publication in the Morbidity and Mortality Weekly Report from the CDC that took a look at 148,494 adults with COVID-19 during an emergency department or inpatient visit. And this was across 238 United States hospitals from March to December of 2020. So this was in a pre-Delta time. We really don't know whether Delta is going to make any difference in this. But what they saw is among those patients, there was a strong correlation to overweight and obesity, where 28% were overweight and 51% had obesity. And what they found was that the risk of mechanical ventilation and ICU hospitalization, as well as death, was increased with higher BMI. So basically, overweight and obesity were established to be risk factors for invasive mechanical ventilation and also for hospitalization and death. And this was a particularly strong association in those under 65 years of age. So we know that obesity is a risk factor for severe COVID-19, and that is very common. It affects about 42% of adults in the United States. And we also know that it's a risk factor for other chronic diseases like diabetes and heart disease and even some cancers. And the Advisory Committee on Immunization Practices has also said that they consider obesity to be a high-risk medical condition for COVID-19, and that is why those with obesity were in that first phase, if you remember, in those early phase for being prioritized for the COVID-19 vaccine, because we knew about the elevated risks. But initially, we really weren't sure if the risk was really the obesity itself or if it was related to those underlying conditions. But this analysis, and another one that I'll touch on in a moment, did account for those underlying conditions. So once you controlled for those underlying conditions, they still found the association between overweight, obesity, and poor outcomes with COVID-19. And what they found was at the lower end of the BMI spectrum that the risks of ICU and hospitalization and death were the lowest out of this group now in the lower BMIs. But then it increased sharply with the higher BMIs. And so we don't know exactly why this is happening, and there really does need to be further study to understand this. but we think that possibly this could be related to chronic inflammation. We know that COVID-19 can really set off a very potent inflammatory response, particularly in those who progress to more severe disease, and that chronic inflammation really gets in the way of the immune response and the normal response that we want to have to pathogens, especially or in particular to COVID-19. The other thing that we do know is that lung function can be impaired from the excess weight itself. So those are some of the working theories around what is going on with obesity. There really does need to be considerably more study in this regard, because again, this is something that is in particular affecting younger people, including children, and overall in those under 65. So we will be keeping an eye on more studies so that we can better understand what's going on. Kaiser Permanente of Southern California also did a fairly large analysis of almost 7,000 patients with COVID-19, and they also found an association between body mass index and the risk for death. And again, this was even after they adjusted for all of the obesity-related comorbid conditions like diabetes. And again, they also found that the risk was most significant among those, in this case, among those who were under 60 years of age. And it was also more significant in men. So again, this is something that we should all be thinking about, because one of the reasons why my concern was really raised around this issue is because I have been hearing a lot, well, I'm young, I'm healthy, I'll do fine with COVID-19. And it became increasingly clear to me that it is not very well known that overweight and obesity all by itself, without those other conditions, is actually a risk factor for doing poorly with COVID. So week after week, as I've talked about being able to do a risk-benefit analysis for yourself, I want you to absolutely understand what all of those risks are, and this is one of them. So as we continue to have to exist with COVID, let's remember the basics. When we are indoors, it is not as safe as being outdoors. Being close together is not as safe as being further apart. And we want to spend shorter time periods, which is safer than longer time periods, particularly in indoor spaces that are not well ventilated. Remember, if you have symptoms, get tested right away. And remember that those symptoms can, in addition to the cough and shortness of breath and the loss of taste and smell, which everyone is familiar with by now, remember that other symptoms can include headache, sore throat, runny nose, sneezing. And so any of those symptoms, get tested right away, whether or not you are vaccinated. If you believe you were exposed and you have either not been vaccinated, or if you work in a high risk, high exposure environment like in healthcare, then we want you to go ahead and get tested in 3 to 5 days. And in most cases, you will need to isolate until you get your results, particularly if you are unvaccinated. And if you test positive, please do what you can to get your close contacts to get tested and isolate themselves as well. If you are positive and in a high risk category, please inquire about monoclonal antibody treatment. For all of us, to optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, get some physical activity, eat a balanced diet, and get a good night's sleep. This concludes today's People's Health Briefing. If you have any questions, please feel free to email them to admin@rootsclinic.org. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.